It has been a while since we provided some context on the amount of testing we have carried out since the start of operation. So here are the latest figures. Total number of persons tested for COVID-19 in this country thus far, 9,585. Total number of samples results available for COVID-19, 8,975. Total number of results that were negative for COVID-19, 8,945. Still waiting and pending laboratory results, 292. That leaves us a total of confirmed PCR or polymerase chain reaction case to date at 31. So let me repeat again that in our country to date, the latest is that we've got confirmed cases of 31 in our country. Total number of active cases are 19 altogether. That means these are cases that are being isolated for the time being because they are still active. Today I can confirm that we have received one more positive case in Port Moresby, bringing our national counts to 31, as I alluded to earlier. This case was tested using what we call the gene expert testing, and the result was received after lunch today. Our surveillance team has been tasked to bring this patient into isolation as soon as possible. This would bring the number of active cases being isolated by the National Capital District Provincial Health Authority to 18.
These two young brothers suffering a devastating loss, with both of their parents dying from COVID in the space of 2 weeks.
I didn't get to say goodbye to my mom or my dad, no. And that's what hurts me the most.
Cases still surging in many parts of the country. Washington State seeing a 25.5% increase, the spread largely driven by young people aged 20 to 29. At least 9 states setting new records for hospitalizations.
COVID-19 appears to be on track to becoming one of the leading causes of death in LA County.
Lines continue to stretch for miles at COVID testing sites from Texas to California and Florida. A growing number of governors now implementing statewide mandatory mask mandates.
If you love the president, join him, be patriotic and wear a mask. If you don't like the president, then just wear a mask to spite him.
Infections around the world also surging. Trends on infections from the World Health Organization suggesting there could be another 1 million new cases globally in just the next 4 to 5 days. As for a possible vaccine,
I think it's going to be the first part of next year before we start seeing people getting vaccinated.
Meanwhile, weekly unemployment numbers in the U.S. rising for the first time in more than 3 months. New data released this morning shows an additional 1.4 million Americans filed jobless claims last week.
A school and a childcare centre shut down as the spread of coronavirus further infiltrates Port Stephens.
We don't know how many kids have just been affected by this, just from one kid at a school, which that school actually affects the majority of Port Stephens.
It is worrying. We always thought school holidays that people would maybe bring something.
A primary school student, a 1-year-old and a 30-year-old man have been infected after a positive case earlier in the week. In Sydney, a staff member at an Ashfield aged care facility has the virus, but the risk of spread there has been deemed very low. Even so, the home has been locked down.
I'm always concerned about outbreaks in aged care homes.
The worker ate at the Thai Rock restaurant and, along with the Port Stephens cases, are among 9 new infections connected to that cluster. Queensland has now declared Fairfield Council area a hotspot, so people from there can't enter the state. The Crossroads Hotel outbreak has 3 more cases. There are also 3 other new cases where the source is unknown.
What is a message is that I think it was the 27th of June, Victoria had 41 cases, and that's only 3 weeks ago. So I think that we do need to be on high alert.
tomorrow, there'll be tighter restrictions on pubs and restaurants that'll limit numbers and mandate COVID-safe rules. The government is vowing to be tough on ensuring businesses comply to try to stop more outbreaks and avoid a lockdown like Melbourne.
The cost of the Victorian-style lockdown to the New South Wales economy would be $1.3 billion a week.
And in response, the government is urging everybody to limit their outings, especially this weekend.
When this 34-year-old coronavirus patient felt his life slipping away, he grabbed his mobile phone to say goodbye to his family. He died just hours later.
I begged with the nurses to do something. Why would they keep a patient with such severe issues in a general ward? He should have been moved to the ICU.
Indian healthcare workers have been trying to put a brave face on this pandemic, but various stories of neglect are fueling distrust in the public system.
My brother wanted to get out of hospital, otherwise he said he would die.
India's fourth largest city, Hyderabad, is combating a surge since a nationwide lockdown was lifted. Doctors and nurses fighting the infection with already limited resources are at breaking point.
Sweating. So mainly is dehydration. They cannot even go to toilet in between.
We have started surging and we are still in the ascending phase. Once we touch the peak, we will be in plateau for some time.
Hello.
Australian mum Swati Balajapali was stuck in Hyderabad for months, separated from her husband in Australia. She refused to go to the hospital despite her infant son's vaccinations being overdue.
It's completely unsafe to go to a hospital here and get his vaccination done.
They probably didn't step out of their home for the last 3 months.
And there's still a long way to go, with India's peak expected to be months away.
So when Mumbai was surging and Delhi was trying to grapple with those issues, the other cities should have anticipated similar problems.
A fight that's far from over.